I'm Elly Pilavachi. I'm the BMA's Medical Student Committee co-chair. Well, my colleagues already outlined how the health and social care bill is going to be affecting us all. The BMA stance is that we've recognised the medical profession's lack of support for the health and social care bill, the lack of support from the majority of GPs for involvement in GP or clinical commissioning as proposed. And we've rejected the bill as a whole. Previously we were engaging in critical engagement with the government, but when we realised that the listening pause and exercise didn't mean anything for us, we had to go against it as a whole. So although the Lib Dems have made the bill less bad as such, the policy of the bill still remains the same. Overall, to abolish the NHS as we know it and introduce mixed financing and greater commercialisation and commercial control of the scope and allocation of government-funded healthcare. I won't go too much into the clinical area of it, but overall the government doesn't have a mandate for this bill, either from the electorate or the coalition agreement, and most healthcare professionals don't support it. So the Royal College of Nurses doesn't, the BMA doesn't, but nor does the Royal College of GPs and Midwives, UK Faculty of Public Health, PEDS, Child Health, Royal College of Radiologists, Chartered Society of Physiotherapy, Geriatrics, Common Practitioners, Health Visitors, Royal College of Physicians, Psychiatrists, Institute of Healthcare Management, Royal College of Gynecologists, Allied Health Professionals, Psychological Society and Royal College of Surgeons. And this is all under the idea that competition is hopefully supposed to be improving productivity, equality and efficiency. But actually the word competition doesn't really mean anything. And the research there's been no research to show that competition is going to make any positive impact on the NHS. It's a huge organisation. It's the third biggest employer in the world. And so we don't really know what competition is going to mean for us, because competition doesn't save lives and it doesn't make hospitals more efficient, people do. And all the people who make up the NHS are just consistently being ignored. So well as the safety of our patients, as students we have our own future to consider, and the health bill is going to have massive impact on our training. So I'll go into I know most of you aren't medical students, so this isn't all relevant, but we're really worried that the money that's been allocated for education and training might not be spent efficiently and effectively and might not actually go wholly towards education and training. Private organisations are going to be able to bid to be hired to provide such services, and those that provide healthcare services on top of that might expect to provide education and training, but private providers aren't going to do more complicated healthcare cases, which are more expensive, so trainees are going to completely miss out on that area of training. And overall, we see the kind of reforms to education and training as far as medical students is concerned, it's just going to lead to more destabilisation, and especially seems the future funding for teaching hospitals isn't guaranteed. So kind of overall, I'm going to skip most of that, but overall what's kind of left to all of us. So I know from the BMA's perspective, we've been talking about medical professionals, but the NHS is for everybody in the UK. And whether you are going to work within the NHS or whether you're going to be a patient, or more likely your parents or grandparents are going to be imminently more likely to be patients, we have to reject it as a whole. And there isn't much time left. On the 20th of March, the bill goes back to Parliament, and it's most likely it's going to go through, unless there's only two people who are really going to be able to stop this bill at the moment, and that's David Cameron or Andrew Lansley. And unless we manage to do something quite epic. So there is still a chance. For those of you, you can write to your Lib Dem MPs, and you can write to someone else's Lib Dem MPs and demand to know why they aren't rejecting the bill. Anyone on Twitter, a lot of people are trying to tweet their Lib Dem MPs about opposition, and generally asking them to vote against the bill. And for anyone who's a medical student, Medicine UK, MEDSIN, has got various different actions that we can perform specifically as medical students. But yeah, if we don't do anything about it, what are we going to say in 5, 10, 20 years' time when people ask us what we did to stop the NHS being destroyed, and turn into a healthcare system that might very similarly mirror the US system quite quickly. But yeah.